In Denmark, 10,000 patients with bipolar disorder use lithium, and many of them use it for years or decades. They have to take blood tests 3 to 4 times a year to measure the concentration, and it has to be timed exactly 12 hours after the patients took their last lithium dose. Our invention can calculate the 12-hour level when the blood test is taken at a completely different time. My name is Ole Köhler Forsbach, and I'm a clinician at the Psychiatric Hospital in Aarhus and an associate professor at the Department of Clinical Medicine at Aarhus University. In psychiatry of patients with bipolar disorder, lithium is the most efficient drug we have, but it has a so-called very narrow therapeutic interval. So every patient has to be perfectly tuned on its dose, and just slightly higher dose can lead to intoxication, acute hospitalization, or for the long-term risks, chronic organ damage, chronic kidney disease. Or if the dose comes a bit lower, there's an increased risk for a relapse, hospitalization, depression, mania, suicide at its worst. So the 12-hour value is really important to get the right dose for the individual patient within that narrow interval. So I was living in Boston in the States during my PhD, and we were working on different data sets. And at one data set, there were patients with lithium were asked, okay, how many hours ago did you take your lithium? And based on this retrospective data, we came to think about, okay, if we have this information, can we actually estimate the 12-hour level? So based on that, we then developed the equation, the formula, and then we performed proof of concept trials to prove that it actually worked, which it does. And now we're at the point that we're actually planning an implementation trial. Yeah, when we started, I also thought that it would be easy to implement a mathematical equation into a hospital system, but it turned out that it's not the case. So this entire setup turned out to be so complex. You quickly realize that the clinical expertise is not enough at all. You need regulatory experts, health economics experts, IT experts. So the main challenge is to get help from several different expertises in solving this very, very specific issue. So it's primarily an IT solution. So I have actually for several years worked with TrustWorks, who is a private company, an IT business company. So they helped a lot with the IT setup, UX surveys, and to think in a different way about this issue. So we calculated that when we consider that there are 10,000 patients who take lithium in Denmark, and there are approximately 40,000 lithium blood tests a year, and also the risks for being on a too high lithium dose or too low lithium dose in terms of hospitalization, relapse, and so on. So that would be a so-called net monetary benefit between 20 and 50 million crowns per year in Denmark just by implementing ELI 12. If you as a clinician think you have a good clinical idea, go for it. Seeing your invention, ELI 12, coming to life, and now we're planning an implementation trial, and see that this actually could come into the real world and be used by other clinicians, help patients to improve their treatments, that's of course huge.